The best of Money Matters. Right Business.
Welcome to The Right Business, where we dive deep into the stories of trailblazers who dare to disrupt the status quo, find the gap in the market to find the right business. Hello, I'm Hongbin, Jeong. Addiction treatment has long focused on managing symptoms, but what happens when the root cause, trauma, goes unaddressed? Well, this is where Yatra Trauma Centre comes in to address. Yatra takes a trauma-first approach, addressing the root causes of addiction with individualized care, therapies like EMDR, and holistic methods that promote long-term healing. And to share more about how Yatra is addressing this through its innovative trauma-informed care approach, joining us today is Mike Miller, who's the founder and clinical director of Yatra Trauma Centre. Hi, Mike. Welcome to the show.
Hi, thank you for having me.
Thank you so much for joining us. Mike, we read that during your extensive experience in mental and behavioral health, you recognize a significant gap in how addiction is treated, especially here in Southeast Asia. What gap did you identify, and how did this lead to the creation of Yatra Trauma Centre?
Well, I have, as you say, worked in the field of mental and behavioral health for over 20 years, primarily with addictions. And the common thread that I saw through working with many clients was that there was underlying pain and adverse experiences that was leading to their behaviors. And so basically the way that I looked at it was, there's compulsive self-soothing behaviors based on underlying issues, and a lot of the time that wasn't being addressed. Typically, traditional treatment or rehab centers address the symptoms as opposed to where the symptoms are coming from, if that makes sense.
Right. Well, Yatra is one of the first trauma centers here in Asia focusing on addressing the root causes of addiction. Help us, share more about Yatra's core mission and the specific services you provide for trauma healing, and how is your clinic different from other rehab centers or trauma centers?
Yes, well, I guess I can combine this answer with a bit of the last one, because you had asked how it had led to the creation of Yatra through what I've learned from working in the field for a long time. Prior to COVID, I was working at an addictions treatment center, and I think just philosophically, I started to see things a bit differently. During COVID, I really focused on the underlying traumas that seemed to be driving the addiction instead of focusing on the addictive behaviors themselves. And that's sort of where I decided that having my own place that sort of aligned with my values and my philosophies sort of made sense. The difference between us and other places, I think, in that is that we do go for we have a saying, addiction is the smoke, trauma is the fire. And a lot of places sort of work on clearing out the smoke, which is fine. The smoke needs to be cleared. And yet if the fire is still burning, you can look forward to more smoke later, theoretically at least. So our core mission is pretty simple. We want to help people overcome the trauma that's preventing them from living the life they deserve. And that could be affected through compulsive self-soothing behaviors, or what we would call addiction. We knew that there was a lot of rehabilitation centers in Southeast Asia, primarily and particularly here in Thailand. Chiang Mai has many of them, and while they all serve a place, and I'm not speaking badly about any of them, that's for sure, they just do things a little differently than we are. So we knew that there was a gap, a bit of a niche for us, that we could focus purely on the underpinning issues as opposed to the symptomology. And that just allows us to be more client-focused, more client-centered, potentially have a more compassionate approach, because we're not working for a particular system, we're working for the clients.
Okay, very interesting. Well, you emphasize methods like EMDR therapy and practices that regulate the nervous system. Could you walk us through how these therapies work together to help clients move from a fight or flight state into a more relaxed and receptive healing state?
Yeah, absolutely. So if we run on the assumption that when people become dysregulated and they get stressed and they're in that fight or flight state, fight, flight, freeze, potentially based on past traumas, they're going to want to regulate themselves. We want to help regulate the nervous system so that people can feel safe in their body, and they can feel, if they get out of that fight, flight, freeze sort of stress response, the survival response, with adrenaline and cortisol rushing through their body, if they can be relaxed, and the part of their brain that is driving the system at that point is the stress response, if we can get them relaxed and get them back into their prefrontal cortex, they can make better decisions. So a lot of traditional treatment goes into cognitive therapies and ask you to think better. But when you're in survival mode, you can't make your best decisions. And I can't really think about self-actualization if I'm worried about surviving things. So if people can feel safe and they can feel safe in their body and their nervous system is regulated and they can breathe and they can relax, then the chances of them being able to, at that point, participate in more cognitive therapies will be possible. So we do that through sort of hacking the nervous system with breath work, with mindfulness, with yoga. We use EMDR, which is eye movement desensitization and reprocessing, to desensitize past memories so that present day triggers aren't as activating. So as an example, if there's a dog that was kicked when it was younger, when it sees an adult human, it's going to sort of recoil. So the present day trigger is worse because of the past experience. If it had never been kicked and it saw a person, it probably wouldn't recoil and be afraid. And humans are like that. If I've been betrayed by someone, if I've been abandoned by someone, in a present day relationship, if I feel like I might be abandoned, I'm going to get dysregulated. I might possibly medicate myself with some other type of behavior. Well, if we can go back in time with the EMDR and we can process the past abandonment, then my present day triggers in my relationships won't be as much. And at that point, I don't need to move into self-defeating behaviors or compensatory ineffective behaviors. So really, we use the body work to calm the mind, and then we use the brain to help people make better decisions in their life about going forward and doing healthier things.
Well, you've also chosen to maintain a clinician-to-patient ratio of 3-7, which is notably more personalized than many other rehab centers. How does this approach enhance the therapeutic process and improve long-term recovery outcomes for your clients?
Yeah, that's a great question, and it is important to us. Typically, one clinician would carry a caseload of anywhere from 6 clients themselves. And if that's the case, how much time do they have for that client and how personalized can the treatment be? And also what happens is that clinician, is that therapist the right therapist for the client? So we know there are 3 predictors to good outcomes from therapy. The first one is, it's called the therapeutic alliance. Can you connect with the person who's sitting across from you? Because if you can't connect with the person sitting across from you, they aren't going to be able to do the next 2 predictors. And the second one is, can they instill hope in you? Mm-hmm. If they can't instill hope in you and you can't connect with them, there's probably not a lot of chance that you're going to have a good outcome. The third predictor is what type of therapy they do. So if you can't connect with someone, you can't instill hope, what type of therapy that you do probably doesn't really matter. So by us having 3 therapists for a maximum of 7 clients, we can try our best to find the right therapist for each client that comes in so they can build a strong therapeutic alliance, they can build hope, and then we get into using the therapies, the EMDR, internal family systems, some cognitive behavioral therapy. At that point, we've built strong relationships, we've instilled hope, and the chances of the outcomes being better are pretty good at that point. It's also that if a clinician has more time to spend with a lower caseload, they can be more creative in some of the applications of the therapeutic work. It doesn't have to be just we sit in an office for 1 hour doing therapy. We might take them off site and do something therapeutic for them because it's beneficial to the client. Whereas if you're working in a big center with a big system, you can't have a clinician, generally speaking, leave the site with 1 client because he's got 5 or 6 other clients, or she has 5 or 6 other clients that they need to give their time to. So It just allows us to be more personalized, I think.
So how do you assess each client's, specific needs, and how does this inform the personalized treatment they receive at Yatra? Is there a specific list of questions you have to ask the patient?
Yes, many. We use many assessment tools. We use our own written biopsychosocial assessment, so biological questions, psychological questions, and socialization questions. And then we go into using psychological tools to assess, looking for specific diagnostic criteria to sort of understand what the lay of the land, I guess, right? The clinical landscape, as we call it. I want to understand everything I can about that client because the more I understand about their relationships with their family or with their partners might indicate which therapist they work with. If we have a woman coming in and she's been betrayed by males in relationships, then perhaps she wants to work with our female therapist. So the more information we get from them, the more we can sort of design their treatment to be specific to their needs. It might also inform, do we get them to see our psychiatrist or not? Like, what is their medication history? It really just gives us a full picture, and then we can design the treatment more for their specific needs, as opposed to having a sort of cut and paste, one size fits all treatment model. In my experience, a lot of centers will say we have individualized treatment plans. And what that means is you're going to do the exact same thing as everyone else, but you're going to have a different counselor than someone else. And that isn't really individualized treatment. That's systemic. And that maybe, that can work for some people. We just do it differently.
Right. I mean, the whole thing about Yatra is that, your belief that trauma, not addiction, is the root cause of many behavioral health issues. So in your experience, how often do patients come to Yatra after having undergone multiple addiction treatments that focus solely on the addiction without addressing trauma? Are there any long-term consequences of ignoring trauma in addiction treatment?
Yeah. So when we first started 3 years ago, two of our first clients that came in, one was 14 years clean and had gone through traditional treatment and had joined a 12-step recovery program. And he got good stuff from both of those things. And yet he still reported feeling very anxious, ill at ease in his body, and didn't know why, because he was doing everything that had been suggested to him. Another woman came in and she was 9 years sober, had done the same thing, done traditional treatment, had become part of a 12-step program, got good stuff from it, because obviously she was 9 years sober, but also lots of anxiety. And, both of them reported having some unhealthy behaviors they wanted to change. So there's just some limitations to what traditional treatment can do. And to be fair, there's limitations to what we can do as well, but we just do things a little bit differently. We think, again, if we use the addiction is the smoke, trauma is the fire as a sort of metaphor or analogy. Sorry, I'm not an English scholar. I get the two confused. But if that's the metaphor, then if we are ignoring the trauma and just addressing the addictive behaviors or the substance use or whatever it is, they're only using that behavior or substance in order to soothe pain. If we don't get to the root of the pain, they're going to most likely go back to soothing themselves or suffering. So if we can help heal the pain, there's less need to go into these unhealthy behaviors. So I think it's paramount that we treat the underlying issues. And, I don't know that happens in most places. And part of it is just time, lack of resources, etc.
Okay. Well, then how do clients typically feel about their progress during the treatment process at Yatra? And what kind of feedback have you received from those who've completed the recovery journey at your center?
That's a really good question. Typically, we hear things like, this is the first time that I have felt heard, understood, cared for. A lot of people, if they have attachment wounds or abandonment issues from when they're young, they've never had people that actually just unconditionally cared for them. And that's an important thing for us to do, is to be very compassionate and caring and meet our clients' needs. And so they report that it's very different in their experience with us. They will tell us that we do quality of life surveys, and we see the improvements over the course of their treatment and after treatment. And some of the feedback that we get is really quite astonishing. And, there's a part of me that really loves getting feedback, and there's a part of me that gets uncomfortable with it because I don't want to take credit for it necessarily, because these people are doing really hard work. But, they tell us, recently we had a client who sent us some feedback, and I can just read some of what he had said to us. He said his healing began at Yatra. It's a therapeutic community that helped him safely explore and transform the roots of his trauma, that our work grounded in the internal family systems, EMDR, somatic work, and deep nervous system repair changed everything for him. For the first time, he said he stopped trying to fix himself and started listening to the parts of him that were trying to protect him, even when they caused chaos. That's internal family system stuff. He learned how to sit with discomfort without running. He didn't have to medicate it. He developed a relationship with his body and his emotions, and he built internal trust in himself. He said the work helped him to move from shame into responsibility and from isolation into connection, a way home to himself, not as a spiritual bypass, but as a daily act of grounded presence. And that's specific feedback that he gave us. And it's not atypical. That's quite common. We get people saying, like, I feel cared for, I feel loved. And it gave me the space where I could do the kind of difficult, challenging work that I've been avoiding for a long time and make transformational change.
That's great. I mean, those are the stories that keep you going, right? Well, Mike, Yatra's approach to trauma care and healing is clearly making a positive impact, especially hearing your stories there. But as you look to the future, are there any new services or initiatives you're particularly excited about to further enhance the experience and recovery of your clients?
Yeah. So one thing we do is when people leave treatment, I'm a big proponent that when you walk out of our gate, it doesn't end. Our support for you doesn't end. And to that end, we have online aftercare that's free and lasts forever. So people can join meetings with us on an ongoing basis. We also have clients that have moved into our community, and they're not from this area. We have one from Australia and one from Canada, and they've moved into this area specifically to stay sort of grounded and connected to us. So we're building a wider community of people that we can continue to give support for, and they're still welcome to come to the center, and they can attend our groups, or they can, participate in certain activities with us as part of the care. And that's an ongoing thing. Part of our, remit, for lack of a better word, is that we want to give back, and we think that treatment should be accessible and not just to people who have lots of money. And we know that cost can become a barrier. So in our first 3 years, we have given away over $300,000 in treatment people that for scholarships, either a full scholarship or a partial scholarship. Maybe like someone gets half price if they have some financial barriers, or maybe someone gets free treatment. And we've been doing that on a continual basis. There's almost always someone at our center who has some kind of scholarship going on. And right now, what we've done in response to the earthquake that affected Myanmar and Thailand, I was thinking, this is my adopted country. I'm Canadian, but I've been in Thailand for 12 years. I'm married to a Thai woman who is also my business partner. She's basically the brains and the glue that runs the whole place and keeps it together. But I wanted to give back to the community in some way that's been really negatively impacted by this big earthquake. Right. And so we've offered up to 5 free sessions for 5 individuals that were affected by the earthquake, and up to a 2-week inpatient stay for someone who is very adversely affected by it. So obviously we will assess their needs, etc. But, we thought it was important to, in a time of crisis, to be able to provide as much support as we can as a small organization, but to do our part and help the community that we operate in.
Amazing. Well, thank you so much, Mike, for joining me today.
My pleasure. Thank you so much for the conversation and being interested in what we do.
Thank you. That was Mike Miller, who's the founder and clinical director of Yatra Trauma Centre. This has been The Right Business with me, Hongbin Jeong.
To listen to more great interviews, download our podcasts at audio.sg or download the audio app. That's AWEDIO, audio at the App Store and Google Play.